Good morning, everyone. I know it's hard to stop this deep conversation. We'd like to just take 3 minutes. If you've got a great idea for us on the question, where are the microphones? There's one up here, one over here. Is there one back there? Yes, one back there. So if you have a great idea, go to the microphone now, say your name and your idea. Say what the question is. Good morning, sister.
Sister Callista Roy from Boston College. We were looking at number 4. We actually did a couple, and there's lots of good ideas from this table, but this one I want to share. How should and how the Academy help develop fellows' expertise in policy? The answer is yes, we should. And I think the way it could, I think the Academy meetings have been doing a great job, but I think for the rest, new fellows and ongoing fellows, we need to keep it up during the year. So maybe a quarterly, skipping summer quarter, webinar. Take your excellent speakers and do small training sessions that people could just sign on to. Because I think it is an area, I'd rather have it be grow the people we have than try to have it as a prerequisite. And I think that would be a way to do it.
Great idea, and I'd like to point out that our Secretary, David Keepnews, produced a webinar for our Jonas Policy Scholars on how to write a policy brief. That's online. It's available to you to use, download, use in your classes. It's excellent. Thank you, David. Over this microphone.
I'm Pat Patrician from University of Alabama at Birmingham, and my group wanted to address question number 3, how should the Academy emphasize policy impact for new fellow applications? And our group felt that there's a lot of state leaders now, especially with the health action coalitions in each state, and we need to emphasize to the nominating or the selection committee that policy impact is on many, many levels, and sometimes people who are active at the state levels have a greater impact than some of them at larger levels. So there's a lot they're doing with the action coalitions, and
Great.
Please keep that in mind.
Great, thank you. Thank you. That microphone will get one or two more in.
Barbara Nichols, University of Wisconsin-Milwaukee.
And a living legend.
And a living legend. Living.
Glad you're living.
We took question number 1. How should the Academy encourage applications from individuals in those states in which no applications have been received over the last 3 years and few applications have been received over the last 5 years? We said group these states into 3 regions. For example, New Hampshire, Rhode Island, Vermont, and Maine, Idaho, Michigan, North Dakota, and Wyoming for number 2, and number 3, Arkansas, Louisiana, Kansas, and West Virginia. Take fellows from each of those states to form a regional committee, and they would then be responsible for recruiting regionally.
Great, great idea. Thank you. Okay.
Sally Lusk, University of Michigan. We also discussed number 4 and had suggestions for moving content like you had in the special session, the Leadership Council sessions, as part of the regular program. Establish a mentoring program with breakout sessions led by experienced persons as part of the regular program, and an Ask Me buttons for those experts to wear so that as you saw them at coffee or whatever, you could ask questions.
Great. Those are all fabulous ideas. I'm afraid it's time, though. I'm going to ask you to take your cards and leave them on the table. We will pick them up at the break or at the end of the session, but these were fabulous ideas, and I'm sure that the new board is looking forward to looking at all of those ideas. Thank you, and thank you, Joanne, for starting Can We Talk? So the Academy bylaws specify the quorum of an annual business meeting as at least 100 regular fellows in good standing in attendance at the meeting. I think you are all in good standing, so I can safely say that a quorum is present. The business meeting will now come to order. As we begin our meeting, we pause to recognize the fellows who have left us this past year. We remember their leadership and honor the work for the Academy. Connie Curran, Catherine E. Barnard, Verdell Bellamy, Marie Bourgeois, Patricia Branowicki, Mary Flaherty, Margaret Frieda, Marjorie Gordon, Lori Gunter, Nancy Klein, Joanne McElbust, Francine Margolius, Kathleen Miller, Virginia Newbern, Dolores Schumann, Etherline Shaw Nickerson, Honorary Fellow Louis Stokes, and Elizabeth J. Thompson. If anyone in attendance knows the name that was not read, please proceed to a microphone and share that name.
Doris Blaney from the great state of Indiana.
Gail Harkness from Massachusetts.
Thank you. We'll now have a moment of silence as we remember the lives of these outstanding individuals. Thank you. So, a special welcome is extended to the 2015 class of Academy Fellows. Would the new fellows please stand? Thank you for attending this business meeting, and I remind you that you are welcome to participate in the discussion and cast your vote whenever a vote is called. Now I would like to present your current board of directors. Will the board of directors stand as your name is called? Please hold your applause until all have been introduced. President-elect, we're soon going to drop that elect, Bobby Berkowitz. Secretary, David Keepnews. Treasurer, Lauren Aronson. Board members Julie Fairman, Ruth Kleinpel, Ramon Lavandaro, Ellen Olshansky, Eileen Sullivan-Marks, Deborah Toney. Please thank this board. And I'd also like to recognize our Academy CEO who's done an extraordinary job of leading this Academy, Cheryl Sullivan. And also joining us this morning is our reliable parliamentarian, Lola Fair. Two of the Academy's fellows serve as executive leaders in the American Nurses Association, so we welcome Pamela Cipriano, President, and Marla Weston, CEO. There they are. The first item of business is adoption of the standing rules. The rules are printed in your program book. May I have the motion, please? So moved. Second? All in favor? Aye. Opposed? The motion, it is moved and seconded, and there's no discussion. We've adopted that motion. The motion before you is adopted. Okay, keep going. No, keep going. The next item of business is approval of the order of business. The agenda is printed in your business meeting materials. May I have a motion, please? Second? All in favor? Aye. Any opposed? Thank you. Motion passes. The minutes of the 2014 business meeting were approved by a committee of 3 readers. Those readers were Karen Cox, Lucy Marion, and Adilma Yearwood. We thank them for their service. Are there any questions related to the 2014 minutes? Okay. We'll proceed on that. It is, okay. As readers for the minutes of the 2014 meeting, I am appointing David Keepnews, Pamela Minerick, where are you, Pamela? There's Pamela, and Rosa Maria Gonzalez Guarda. There's Rosa. Thank you all for your service in this capacity. The next item of business is the report of the president. I've organized this report around our strategic plan to share with you the progress that we have made. If I could have, we do have the slides, thank you. So I would hope that you would have our strategic goals memorized by now, but I'm going to put them up here anyway. The first one, I have the clicker. The first one relates to our continuing to influence the implementation of healthcare reform in the direction of the triple aim. And we do a lot of this work through our Raise the Voice work in the Edge Runners program, and I want to acknowledge the co-chairs of the Raise the Voice work. The initiative is Donna Nikitas, Antonia Villarreal, and Eileen Sullivan-Marks. We have a new National Advisory Council that we've put together, and I'm really pleased that our co-chairs are health economist Gail Walensky and journalist Jackie Judd. You're seeing her on PBS Nightly News. We have now 40 Edge Runners. We continue to have a rigorous process and a review committee, and you have seen some of those Edge Runners who got their plaques the other day. Lauren Harden, you heard from her in the first or second plenary, I've lost track. Our own fellow here, Diane Spatz, who has a great breastfeeding initiative, and also, what happened to Karen? Susan Lacey and Karen Cox should be on that slide too. Karen, you dropped off. And the other Edge Runners who couldn't be here with us the other day, Donald Gardinier and Jeffrey Wright. So, thank you. Keep an eye on me today. Jeffrey Weiss. So, I think most importantly is that we're trying to look at what do these Edge Runners bring to the table. We finally published, thank you to Cheryl Sullivan, Laura Wood, Dottie Jones, and Sister Callista Roy, our articles on the commonalities across Edge Runner models of care, nurse design models of care. It was published in this month's Nursing Outlook. I encourage you, if you've not looked at that article, to look at it because it's the themes around what do nurses bring to the table in reforming and designing healthcare and innovations. And so share it widely, please. But we are thrilled that the Robert Wood Johnson Foundation has given us a grant to partner with the RAND Corporation to look at what the Edge Runners are doing around building a culture of health. This will result in a RAND report and a number of publications that will showcase what nurses are doing around building a culture of health and the lessons that they have learned. Another important initiative, I can't quite see the slide. The Edge Runner work is also shaping our policy agenda. So one of the reasons we had the global payment plenary session was because of the Edge Runners telling us that indeed global payments were essential to them being able to address what individuals, families, and communities need and want. So we've been very active on that. We are part of the new CMS Healthcare Payment Learning Action Network that's looking at other payment models and what's working and what's not. And we also, the board has approved an institute for innovation and policy to house our innovation and policy work around, to house our work around the Edge Runners and other work around innovation. We're looking for a funder. If you have a funder in mind, I'm sure we might even have a naming opportunity. Absolutely. Please see Bobby Berkowitz or Cheryl Sullivan. This is really important work, and I hope that you will continue to spread the good work that the Edge Runners are doing. I'm very pleased that we're continuing our work on the role of the RN in primary care. The American Board of Internal Medicine Foundation, they call themselves ABIM Foundation, invited the Academy to join them on discussions around how RNs could be more involved in primary care, play a stronger role. And we have a paper that was published in Nursing Outlook that was put together by a cohort of Robert Wood Johnson Foundation Nurse Executive Fellows, and you can see them up there. And that paper is now informing our next step. That next step is that the Josiah Macy Foundation has decided that its 2016 conference will be on preparing RNs for enhanced roles in primary care. The conference will happen next year. It will be a small invitational conference, and then there will be follow-up regional meetings, and there are some people in this audience that are working with us on those meetings to help disseminate that work. Of course, one of our, another really signature initiatives is our leadership of nursing's role in Choosing Wisely. Now, Choosing Wisely is an ABIM Foundation initiative, but they approached us with, would we develop nursing's list of things that you should not do because they are harmful, or they're ineffective, or they're too costly. And so we launched the first list last year. We've just developed a new list, another list of five, that relate to oncology. We've worked with the Oncology Nursing Society, and more will be forthcoming. We're working with We're working with A1 and a number of other organizations, actually through fellows who are members of those organizations. I'm very pleased that Consumers Report has published our first list and will continue to publish the rest of the recommendations that we have. So if you don't know about Choosing Wisely, please go to the website and look at it. choosingwisely.org or the Academy's website can get you to it. Every clinician should know about this list. The public should know about the list. For example, one of the recommendations is don't wake the patient in the middle of the night unless it's indicated to do so. Yes. So make sure your students and your clinicians know about this list. And then we are engaged in other efforts to disseminate this work. I want to call out Ruth Kleinpel, who took a lead in, we didn't get it, but she wrote a CMS grant for us. And God love you, Ruth. Yeah. Karen Cox has been working with us on this, and some other fellows have been working on the dissemination work. I want to call out Choosing Wisely, Texas. Is Alexia Green here? Alexia Green has been involved with the Texas Action Coalition, and they have worked with people in the state to really look at how to disseminate the Choosing Wisely work in Texas. They've made a video, we started to air it yesterday, about nursing's Choosing Wisely list, and we'll be playing that on the break. That will eventually be downloadable for you that you can use as well. So please look at other opportunities, and here are some others up on the slide, for disseminating the Choosing Wisely list. It's really about getting the right care to the right patient at the right time and at the right cost. Now, another initiative is our Have You Ever Served initiative. It's continuing to get great attention and to move forward. It's rolled out in all of the states. I want to call out and acknowledge Linda Schwartz for her support of this work, and also note that our CEO was invited to the White House to talk about this work with Michelle Obama's staff, because this is part of our response to Michelle Obama's joining forces, and they love this initiative. Again, if you don't know about it, please go to the website, download the information, or read about it, send your students there, send other clinicians there. We know that, so as more veterans are being told to get care in the private sector, we know that probably only 40% of clinicians in the private sector are asking patients, are you a veteran? And if you don't know that the patient in front of you is a veteran, you don't know what their condition is that they're presenting. You may be totally off base. So this is a great resource to make sure that our veterans are getting the right care. And we're continuing to do this work, and I want to thank the funders of this work who are up here. We're continuing to look for funding. So if you would like to support this work, please talk to Cheryl Sullivan. Now, our second goal is around influencing the broad range of factors that affect the health of people, social determinants, culture of health, etc. And this work is rolling out in a variety of ways. We're just ramping this up. The Edge Runner study I've already talked about. I think that will be very significant. The board decided to focus on 3 areas: nutrition, violence, and toxic stress in childhood. And Bobby Berkowitz has led a task force that's beginning to move on some documents. We've already reviewed one on breastfeeding and toxic stress in childhood, and we're looking forward to other contributions from expert panels and through other venues to start looking at what are the positions we ought to be taking on some of this work. We're framing it with community benefit, and hopefully many of you went to the policy dialogue on community benefit the other day. I heard it was very well attended and there was some good discussion. So it's really important work that I think will continue to grow. And Bobby's particularly well suited to, as a strong public health person, to continue to lead this work. These are just some examples of some of the work that has come out this year related to this strategic goal. And you have in your packet, you have a list of a variety of position statements, policy briefs, etc., that have come out of the Academy this year. And these are some of the ones that relate to strategic goal number 2. We are active in signing on to other initiatives that relate to our strategic plan. Judy Haber brought to us a white paper from the National Interprofessional Initiative on Oral Health and asked us to sign on to this statement about integrating oral health into primary care. We've signed on to that. We've signed on to a variety of initiatives. So when you see opportunities like that align with our strategic goals, don't hesitate to ask the board to consider sign-on. These are just some of our other strategic partnerships. We think very carefully about our strategic partnerships. Some of them are pay to play, and we want to use your resources wisely. And so the board makes a deliberate decision about, do we want to invest in this? We use the Riba de Tournier money to start our investment in these partnerships. If the partnership is effective, it's working, it's helping to move the work forward, then we look to build it into our operations budget. So your contributions to Riba de Tournier really help our work. The last strategic goal is positioning nurses to lead change in improving health and healthcare. Now, that's our appointments work. And I was delighted that last year we announced the grant from Pfizer to launch the Institute for Nursing Leadership. It was a matching grant of $50,000, and I thank you, thank you, thank you. We met the match in less than 4 months, so thank you. Now we need you to continue. Continue. Please, let's double that match. And we're looking for other funding sources to keep that going. So if you have ideas, again, let Bobby know and Cheryl know. We have a National Advisory Council, and I want to thank deeply Angela McBride for being the lead chair of the chair of this National Advisory Council this year, and helping us to get that infrastructure going, the governance going, committees going, and to launch our first workshop Thursday morning that was a smashing success. So thank you very much, Angela, for that. And Stephanie Ferguson, the live wire you heard from the other day, is the co-chair, and she will be stepping in as chair next year. So we've got a great transition plan, and you know we will go like gangbusters with Stephanie as well. You're going to hear more about the Institute. Yes, thank you, Stephanie. You're going to hear more about the Institute a little bit later from Angela, but we are moving forward and through that leadership. We've continued to do appointments, and we're focused on gubernatorial, federal, and governing boards of national organizations whose missions align with our strategic plan. So, for example, you might want to consider, for example, a housing advocacy group would align with our second strategic goal. So if you know of a group and you want to be involved, please let Cheryl Sullivan know, and we're happy to work with you to try to support your nomination. This last one. We are getting a new website in the new year. Please, yes. Please update your information continually on the website. We ask you, where do you already sit? What boards, commissions, task forces, et cetera? And we have, I think, over 200 of you have given us that information. Please continue that. You will be able to do that through the website, and you had been able to do it through the website. But now if you're having trouble there, just send Cheryl an email and say, I've got this appointment, and we will add that to the list. We also want to do some succession planning. We are a founding member of the National Nurses on Boards Coalition. This is a coalition that arose through the Institute of Medicine's report on the future of nursing and the Campaign for Action. And so there are state action coalitions at the table, a variety of national nursing organizations. And so we're all working towards getting nurses appointed to 10,000 boards, commissions, task forces, et cetera, by 2020. We've been working on the infrastructure. I chair the sustainability work group. Rita Ray is going to be replacing me, and I thank her for that. And this coalition will, yes, thank you, Rita. Yes. This coalition will eventually be a 501c3 organization. Right now, we have a grant from the Robert Wood Johnson Foundation that has gone through the American Nurses Foundation. Marla Weston is a co-chair of not the foundation, she's a co-chair of the Nurses on Boards Coalition. So we're moving that work forward, and all of this is, I think, very well aligned. Of course, you heard from Suzanne Bakken, who is our 2015-2016 IOM Distinguished Nurse Scholar in Residence. Now, NAM, we got to change that, I think. National Academy of Medicine. And I would urge you again, those of you who are not retiring, this is not for retiring, no. Those of you who want to delve more deeply into an area that you'd like to explore or even make a shift in your career. If you have work that's aligned with the Institute of Medicine, consider applying for this residency. It's fabulous. And Debbie Gross, where are you? Debbie Gross had the idea, this is where ideas can go, for a policy scholars program. Why didn't we have doctoral students and postdocs who could be a scholar and who could be connected with our expert panels and work with our expert panels, be mentored, and help to contribute to the work? We got the funding from the Jonas Foundation. Thank you very much, Donald and Barbara Jonas. And Debbie has been leading that work this year with board liaison Ellen Olshansky. Thank you so much, Debbie. And will the policy scholars stand? Are the policy scholars in the room? If you're a policy, stand. We're loving this program. It's fabulous. Then I want to get to the end here by saying that the board has had discussions about what is the culture of the academy. And that we have a culture that has evolved without it necessarily being deliberate. And it was actually Ramon Lavandero who first came up with this framing, and thank you, Ramon. I think it works nicely. That we want to have a culture of recognition, engagement. We recognize you when you come in. We recognize you as a living legend. We try to give other recognition, but engagement as well. We want your engagement, and that was a theme of Joanne Dish's presidency. Engagement, engagement, engagement. We want you to be engaged in the academy and help you find ways to do that. We also want a culture of philanthropy. We have doubled the number of people who are in the President's Circle. And if you're not, you missed a good reception last night. And you should make sure you're there next year by making your donation to the President's Circle and the Reba de Tournier Fund. We also want to be a model organization of diversity and inclusivity. And we have to define what that looks like and how do we get there. Now, Michelle Richardson is going to be the new chair of our Diversity and Inclusivity Committee. Thank you, Michelle. But we think it's a responsibility that resides among all of us, so that when you're on an expert panel, that you're making sure that you're encouraging the dissenting voice to feel like there's a safe place here for me to say I don't agree. The board has principles of engagement that we use, and one of those principles is to encourage the dissenting voice. And so at this last board meeting, there was a member who said, okay, I'm about to do it here. I'm about to disagree with what's been said. And we all stop and listen very intently. And it actually shifted our thinking and changed what we're doing today. So I would encourage all of you, when you are in the Academy's house, to make sure that you are being inclusive, that you're creating a safe space for the best ideas to come out. So let's own that responsibility, each one of us. And finally, I want to thank this incredible board of directors who have worked so hard this year and the prior year. Some of them have been putting up with this for 2 years. I want to thank you all so much for your terrific work. Please give them a hand.
We're going to standing ovation.
And I also want to thank our CEO, who has enabled us to build our capacity in a stellar way, hired fabulous staff, and continues to represent us in various venues and brings nursing perspectives to the tables in this city and across the nation. Cheryl Sullivan, thank you so much. Thank you. And I don't know if there are any staff in the audience, but I'm going to name them a little bit later. But we do have an incredible staff. And when you see them, please thank them for their service to the Academy. They've done extraordinary work. And finally, I want to give a personal call out to Hunter College and my dean for relieving me of a lot of responsibilities over the last 2 years. Gail McCain gave me what many would consider a very cushy assignment and enabled me to really invest my time and energy in the Academy. So Gail, if you're here, I thank you. Hunter College, I thank you. And my colleagues at Hunter College, David, Donna Nikitas, and others, thank you. So I hope you see the work that we've been doing, and I'd like to move on now to the next item of business, the report of the treasurer, Lauren Aronson. Please welcome Lauren.
Thank you, Diana. That truly was an incredible list of projects and exciting initiatives that we've undertaken. And now my job is to let you know a bit about our financial position and how we are making every effort to continue to afford funding these and other important activities in line with the Academy's strategic plan. But first, I'd like to acknowledge the Finance Committee. They are a very hardworking group, and I'm going to ask them to stand to be acknowledged. Paula Milan-Nuzzo, Eric Yo, an esteemed honorary fellow who serves on our Finance Committee, and Pat Reed-Ponte. Diana Mason, as president, serves as ex officio and actively participates on the Finance Committee, as does Bobby Berkowitz, our president-elect. So we thank them as well. This is truly a hardworking and dedicated group, so I personally thank you all for your wise counsel and careful attention to developing and monitoring our budget. First off, as part of my report this year, I am pleased to report that the Academy has again received an unqualified audit for calendar year 2014. This is an excellent from both an accounting and management perspective. So a very special shout out to to Cheryl Sullivan, our ever vigilant CEO, for helping us not only be good stewards of Academy resources, but also for ensuring that we have appropriate financial policies in place to govern and guide our financial decisions, something that the auditors indeed carefully reviewed. So this is also a good time to thank our audit committee, and I will ask them also to stand and be recognized. The chair of our audit committee is Susan Morrison, and the members of the committee are Lucy Marion, Roy Simpson, Nellie Robinson, Nancy Valentine, Jeanette Ives Erickson, and Deborah Toney was our board liaison. Would you join me in thanking them? Second, as shown in the statement of financial position that is in your business meeting materials, our Academy assets have grown from $4.3 million in 2013 to nearly $5 million in 2014, well above our projections from just a few years ago. I don't have any teleprompter. I'm also happy to report that we remain very pleased with our choice of Rockefeller for managing our long-term investment funds. They continue to perform at or above benchmarks for all of their various funds. However, the most recent data we have for reporting purposes today is through the end of August of this year. And as most of you know, this past summer was not a very good year for the stock market. So while I'm not too happy to report a modest loss for the year through the end of August, it was actually only 2%. And I suspect that most of you will agree that we wish our personal portfolios only lost 2% at the end of August. Now, fortunately, the stock market, as I've observed, has, and I'm sure you have, has improved since the end of August. So I suspect we are in a better position, but we don't have those reports at this point. And even with this modest loss, at the end of August, we still had nearly $2.8 million in investment funds and a total of over $3 million in all of our Rockefeller accounts. So this puts us more than halfway towards our goal of having $5 million in investments so that we can then start using the earnings accrued from these investments to support our policy initiatives. So in addition to the reasonable and hoped for and anticipated continued growth of our investments, we also are moving towards this $5 million goal with our policy, the Academy policy, of putting 2.5% of our net revenues in reserve each year. Previously, this policy of putting 2.5% of net revenues in reserve was used to achieve a liquid assets balance of 4 months operating expenses. And this is a policy or a position that's consistent with other nonprofits similar to the Academy. As I reported last year, we reached that goal, and now we are actively dedicating the 2.5% of net revenues each year towards building that $5 million investment portfolio. And for 2014, I am very pleased to report that the amount we were able to transfer was $73,000, double the amount that we transferred in 2011. So I think that deserves a little applause. This is also the time of year that we work on the budget for next year. And it is a somewhat extended process because the Academy Board and the Finance Committee want to do a thorough and cautious effort in developing this budget. The Finance Committee continues to operate in a fiscally responsible manner. We critically assess estimates of anticipated revenues and expenses, and we develop and recommend a budget to the board. The board does not officially act on the budget until November, which will be next month. And so while it is premature to discuss any firm specifics, in the interest of transparency, the board and the Finance Committee did want to inform you and thought it important to inform you that we do anticipate a dues increase for next year. Last year, I talked about the reality also of the expenses of this conference, and this year, I just want to emphasize that despite all efforts to cover conference expenses and look for ways in which we can save money on our conferences, the Academy, in fact, still subsidizes this conference because your registration fees do not cover fully all of the expenses. So this brings me then to my final comments before entertaining questions, and that is that we need the help of all of you, each and every one of you, to identify and seek sponsors, not only for this conference, but also grant opportunities for the Academy in pursuing many of the wonderful initiatives and new initiatives that we may develop in the policy arena. And of course, we always will ask you, and I'm going to reiterate some of what Diana said, to consider making a generous donation to the Reba de Tournier Fund. It is a wonderful way not only to support the work of the Academy, but also to honor a colleague whose work you admire, or to remember a colleague or a loved one who sadly may have recently or even not so recently passed away. Donations of any amount are truly welcome, but I would be remiss if I didn't mention the President's Circle again and inform you that we have now over 100 members in the President's Circle. And 100%, absolutely, I was fully intending to inform you, 100% of our board are members of the President's Circle. And last night, at that lovely reception for President's Circle members, Diana challenged each of us to reach out and bring at least one more member to the President's Circle so that we might double our membership by this time next year. So thank you to everyone for all of your generous contributions, both monetarily and through the incredible work that everyone does, especially those that Diana highlighted in her report, as we continue to grow and continue to engage in the really critically important work of the Academy, which is where all of us, with our diverse areas of expertise and leadership, are able to bring that knowledge, that passion to the table where policies are made and important decisions to improve the health of our country and perhaps even the world. Yeah. So now I'll be happy to entertain any questions.
Pat Quigley, microphone.
Thank you, Madam President, and thank you to our treasurer. Madam President, I have a motion.
Please read your motion.
Thank you, Madam President. Pat Quigley, a fellow from the Department of Veterans Affairs. Madam President, I move that the Finance Committee prepare a recommended reduced conference registration for retired fellows to the Academy Board of Directors for implementation in 2016. And Madam President, I have a second.
Okay.
May I speak to my
Yes.
motion? Thank you, Madam President. I bring this motion forward to the Academy, to the Board of Directors. I would turn, but the microphone's because this has been brought up at several times, and I appreciate the information that we have related to the registration costs, but it has been brought up over the years about reducing the cost, the registration cost for retired fellows. And yesterday it was brought up in the open forum, and I think that the focus was missed in that we did have someone come forward and say that they were willing to share rooms. But I think that this is something that should be offered and made available to our retired fellows if they choose to take advantage of a retired registration. And I bring it forward as a motion so that it could be deliberatively decided by the body. Thank you, Madam President.
Pat, don't leave the microphone. So I'm advised by our parliamentarian that you probably can't direct the board itself, but should say if you would be willing to amend your motion to say the Academy Board for consideration for implementation in 2016.
Thank you so much for that friendly amendment, and to our parliamentarian. Thank you, I certainly do.
Thank you.
Thank you.
Any discussion?
Do you want me to speak to?
Yeah. Lauren.
Yeah, I will just add a few comments also to that, in that that issue did come up in the open forum yesterday as well. And we did hear that message, and I do know that the board will be discussing that option when they discuss the motion, when they discuss the budget and for its adoption at the November meeting. I will share with this group, as I shared with the group that was at the open forum, just to provide you with a little more data about the costs of the conference. And for not this conference, because we don't have all the bills yet to know what it's actually costing us, but for the 2013 conference, we did a very careful review of the expenses of the conference and putting it against the actual registration costs. At that time, early bird registration was $700, and the actual cost per attendee at the conference was $868. So there is a fairly substantial gap of subsidy, just to inform you of that stretch for the board. But we will look at it and see if there is a way to adjust some of the current recommendations in that budget in light of this motion. And I assume if it passes, I guess, because the membership will vote on the motion, which is a recommendation for a consideration.
Good.
Yeah.
Does anybody else want to speak to that motion? Linda, go to the microphone.
Thank you, Madam President. So I rise to speak against the motion. If we were to profile the current membership of the Academy, you will find it is similar to the current age demographics of the nursing profession. And so the number of individuals who are heading towards retirement in this body is quite significant, So you think about the gap right now in the budget, I think it would be monumental. So I'm speaking against the motion.
Anyone else speaking to the motion? Okay, thank you. The motion before you is that the Finance Committee recommend a reduced registration for retired fellows to the Academy Board for consideration in 2016. all in favor, raise your hand. All opposed, raise your hand. The motion is lost. Thank you. That said, I think what Lauren said is that the board will have a discussion about this. So even though the motion lost, I think the board is already committed to continuing to talk about it. So thank you. Now, I believe there's a motion here, or there's a speaker here.
Or a question? Question?
Yes, I'm Cecily Betts of the Child, Adolescent, and Family Expert Panel, and I have a question about the expenses that are listed on page 14. Could you please operationalize some of the larger dimensions that are displayed with this grid in terms of, for example, for policy, 29.9% was expended for that particular category of expenses?
And you're asking what are the
Yes.
activities that go into
Right,
that?
Right, could you operationalize that, please?
Okay,
Thank you.
the work of the expert panels, the work of many of the initiatives that Diana discussed in her report, the beginning initial, one of the things that Diana talked about is that when we join other commissions or boards, our initial membership comes under that policy work and maintaining our membership. Choosing wisely, the IOM and now NAM Nurse Scholar program, the Have You Ever Served program, all of those activities are the policy work.
Could I ask you if you have that number off the top of your head, how much was expended for the panels? Do you know that figure?
Yeah, each panel gets $700 a year to spend, but I know that they don't all spend it. I do not, however, know a specific figure, but we can do the math. What? Yeah, if you want, give us your name, email, we can send you the actual figure, but I don't have it. But I hope that gave you at least a ballpark to understand, between the number of what's available to the expert panels and knowing that not all actually spend that money.
I think that email would probably be helpful to the co-chairs of our expert panel and possibly the others. Thank you.
And if I could just point out that we did meet with the co-chairs yesterday and pointed out that when you have ideas, where there are new initiatives, that we work with you in terms of a business plan and look at what are the resources it will take and where might we get additional funding. So thank you.
Could I clarify, ask for a clarification of that? Does that money come out of the development fund then? That's 70?
Yes, yes.
So even though it looks like it's part of the Academy's general operating budget, it really comes out of the
No,
development?
this expense pie chart is all of our funds. So the money to support this comes out of the different accounts as appropriate. And if you look at the next page that breaks down what the Reba de Tournier Development Fund in specifics has, we have that breakdown. Oh, and it even has the expert panel total that comes out.
So
I didn't realize that in looking at the...
So you're saying the
so
expert panel money comes from the development fund, not from our dues
No,
operating money?
because it is the expert panel's charge and their work is policy work. That is the policy. That is where the policy work of the Academy begins, is initiated. All of those policy briefs that you prepare and that you want us to engage in or consider activities is policy work. That's our business.
Let me add just a little bit of clarification to that. The Reba de Tournier Development Fund does include the policy work of the expert panels that is not covered by any grant support. The expert panel, the amount, that $71,000, that includes staff work working with the expert panels. That includes any of your expenses, for instance, here, if you required audiovisual assistance or anything else. It includes any, reprints that any of the expert panels may request. So it is the policy work of the expert panels that is not covered through grant support. For instance, the Have You Ever Served is now covered through grant support through the Bob Woodruff Foundation and other grants.
Over there?
Pamela Minerick, Samuel Merritt University in the San Francisco Bay Area. And I rise with a concern, but not with emotion. So I wonder if I can be here at the mic.
Absolutely.
Okay. My concern is about the dues and the dues rising. And if you look at the Can We Talk sheet, the first two questions, one is about encouraging applications from those states where there have been either none or few. And the second one is about encouraging fellows to sponsor new applicants. If I look at many of the states listed in number one, those are more rural states where I imagine, I'm guessing, I live in the most expensive place in the country, I think, so I imagine that many of those states are rural and have very limited or lower salaries. We've also made efforts over the last few years to encourage international members. And I think we're moving into the stratosphere in terms of the dues. So I really appreciate you, Lauren, bringing up grants and some other ways that we might support our membership. But I think that needs particular energy and attention, because I think we are going to price us out of people's willingness. And I know people who have been inducted, been in the academy for a few years and decided they couldn't afford the membership or attendance at the conference. And just looking at my budget, it's gone up for the last 3 years. So I'm concerned about this. I don't have an answer. I wish I did. There are many things about budget I wish I had an answer to.
Yeah.
Thank you.
Well, yeah. We hear you, and believe me, when the Finance Committee and the board do discuss or consider a dues increase, they do not do that lightly. It really is after very careful and critical review of all opportunities to bring in funds. The other point that I will just comment, and I know it feels like it's a large amount, and in many ways it can be considered that. It is not actually, our dues is not that much higher than, or it isn't higher than many other organizations that are similar to the Academy, that are doing the kinds of things that the Academy is trying to do. And, I'm getting a word that we're maybe running out of time, and we have a few questions, so I'm going to see the next question. And
good morning. Congratulations to all the board members, our president. I have a comment. It's not a motion. In our group, we talked about retention and engagement of the membership. And this goes along with the previous person who just spoke. The cost of the Academy meeting and the dues. And oh, by the way, my name is Linda Rose Frank, and
thank you.
I'm from the University of Pittsburgh. I think that the cost is a disincentive to attend this meeting, and I would like to recommend to the board that the people on the Finance Committee consider examining the cost of providing unfettered access to alcohol at this meeting. I think that having an open bar is in conflict with many of the committees that examine issues, particularly I'm a psych mental health nurse clinical specialist. And I would recommend that the funding that is used for alcohol, and in most meetings that I've been to, you're provided with 1 or 2 tickets for a drink. or in many settings, people have to pay for their own alcohol, that this money be used to lower the cost of registration and reduce rates of registration for members who have difficulty finding the money to attend, or for members who are retired.
Thank you very much for those comments. And I think that comment about alcohol is really another good idea that we will, in fact, go back and look at as we put together our expense thing. I also will share with you, just by the way, that, in fact, board members always pay for their own alcohol when we get together for our board meetings. So while we hadn't imposed that yet on the membership, please know that the Academy has not been buying any alcohol for the board. And the other comment about conferences that I want to say that came up at the open forum yesterday was to perhaps post an opportunity for members to room share for those who did not know someone that they might pre-assign or pre-arrange to room share, but to have a posting where members would be interested in sharing a room to also reduce their expenses.
Thank you for considering my comment.
Next question, and identify yourself, please.
I'm Hester Klopper from the Forum of University and Nursing Deans in South Africa and a new fellow. Welcome. Thank you. Madam Treasurer, Madam President, thank you for this opportunity to speak to this issue. I don't have a motion, but a recommendation. And that is that it's my understanding that the Academy is ready to embrace international or members outside of North America, and as we grow those, I would want to request that the Board of Directors and the Finance Committee please consider using the rating scale, sliding scale, of the middle and low income countries for membership fees of the Academy as we move forward, because it's really impossible to afford from low and middle income countries if that's what the Academy wants to do for the future.
Yeah.
Thank you.
Yeah. Thank you. Thank you. This is an issue that we have considered, and we will consider it again as we go forward. Okay, one last question. Please identify yourself and be brief. We are quite behind in time.
Brenda Cleary from North Carolina. And one thing I've noticed about the bar service, they pour a whole glass. So, I mean, that's Hyatt's a corporation, so you have to be a little cynical about that. And I can't drink a whole glass, so it's just a waste. I'd be dancing on the tables. You wouldn't like that.
Thank you. Thank you all.
Thank you, Lauren, very much. The board relies on the work of the Treasurer and the Finance Committee to provide the information needed to make sound financial decisions, and on the Audit Committee to ensure that internal controls are in place. Lauren has been our Treasurer for 4 years. She has done an extraordinary job. Please thank her. The next item of business is the report of the CEO. Cheryl Sullivan will present this report.
Good morning. As we celebrate these extraordinary accomplishments that President Mason presented a few minutes ago, we know that collectively we are still molding the culture of the Academy, she noted. We are still a relatively young organization, and so I want to continue this theme just for a very short couple of minutes. We are molding that culture of philanthropy that you heard about, for example, as evidenced by the 336 contributions. You can see the names of everyone in the program this evening. That's 336 contributors to date this calendar year to the Reba de Tournier Development Fund. We particularly acknowledge those new fellows who yesterday sought us out at the President's Circle reception. They understand very much how we utilize those dollars. Under the leadership of Chair Bob Hess, you should know that donor-designated gifts may now be made to either the Institute Nursing Leadership or the Raise the Voice initiative, in addition to the unrestricted gifts. This is a very substantial movement. The culture of philanthropy at the American Academy of Nursing is being enriched every day at the Academy as donors are making gifts at the level that is meaningful to them to support our development efforts. We are also crafting that culture of engagement as evidenced by the very lengthy list of 391 individual fellows noted in your business meeting packet who participate on one of the Academy's 8 standing committees or the numerous task forces or the national advisory councils, along with expert panel co-chairs and members of the Nursing Outlook editorial board. Engagement in the Academy is also possible, of course, through participation in sponsoring a new fellow, nominating individuals to serve in elected office, or your voting in elections, which we hope you'll do, and of course, supporting the Academy as a donor. We're also crafting this culture of diversity for the Academy as an organization as evidenced by our diversity and inclusivity statement. Yet, I hasten to add that we are acutely mindful of the significant work that we must do collectively to advance the Academy in becoming a model organization that ensures multiple dimensions of difference and inclusion, that they are integrated in all activities of the Academy. Members of the 2015-2016 committee are being appointed by the Academy Board of Directors under the leadership of fellow Michelle Richardson. You should know that for the very first time, joint planning already is underway among the leadership of the Diversity and Inclusivity Committee, the Fellow Selection Committee, the Nominating Committee, to develop common goals for the Academy as an organization. Molding the culture of diversity is a responsibility of all Academy committees, task forces, and individuals. We are crafting a culture of accountability as evidenced by our metrics identified for our strategic plan and for our operations and business practices that are being implemented. While we count the numbers of individuals nominated for national boards, commissions, and councils, we certainly measure the number of successful appointments made and the percentage of appointments that are subsequently filled with a nurse. We track the number of our policy briefs published related to outcomes, equality, and safety, and the number of edge runners that are named and showcased in media journal articles. And working with the Finance Committee and the board, financial policies are in place to assure consistency in financial management and to be transparent in our operations. I trust that you agree with me that our receiving an unqualified audit, the highest that can be achieved, demonstrates effective policies are in place, procedures are followed, and our operations are indeed efficient. And of course, the more efficient we are, the fewer dollars go to administrative costs and the more funds are available for Academy programming and fellows policy work. So we are a lean machine, and I pledge to keep it that way to ensure that your dues, your contributions, and your sponsorships are used appropriately, effectively, and efficiently. We are mindful that for this organization to be a model organization, there must also be a culture of responsibility. This morning, we solicited your wise counsel to help us address some challenges, and I am so anxious to read what your responses are for solutions. Working together, these challenges, too, will be addressed, and we recognize that even with these challenges, we can and we do celebrate our many, many accomplishments and the growth of the American Academy of Nursing. I am grateful for your support, and it is an honor to be your CEO. Thank you.
Thank you, Cheryl. And now the next item of business is the report of the chair of the Fellow Selection Committee. Kay Bender has been that chair. Thank you so much for your good work, Kay Bender.
Good morning. I also want to thank my fellow members of the Fellow Selection Committee and acknowledge their hard work over this last year as 285 applications were reviewed. I want to remind you that in continuing with our standard review procedure, each application is reviewed individually and collectively by a service academic dyad of the Fellow Selection Committee. Both co-chairs review individually and collectively, and then the full committee. So each application gets around 6 or 7 full reviews. This year's acceptance level was 57%. The board worked with us this year in appointing a third co-chair, and it took us a little while to figure out how to divide 18, to eliminate 3 from the reviews initially and divide the dyads in an uneven number. And so after some consultation with Bobby Berkowitz and fellow co-chairs Susan Deanbar and Joan Shinkus-Clark, we developed, I think quite effectively, the role of a co-chair-elect of the Fellows Selection Committee, and we think this will foster both consistency and continuity in the Fellows Selection Committee work. We also, in working with the board, added some clarity. You will see for the 2016 application and application instructions, some clarity in the criteria for review and in the requirements, sort of separated out academia, research, service practice, and then a little bit more around policy and other emerging new areas where candidates now demonstrate expertise. We think these clarifications should help applicants and their sponsors as they work on 2016 applications for fellowship consideration. I'd like to thank Diana Mason, David Keepnews, Bobby Berkowitz, and Julie Fairman for your help with that, and also our advisor for this year, Linda Scott. 2016 co-chairs Susan Deanbar, Joan Shinkus-Clark, and Judy Beal will lead the Fellow Selection Committee in good hands, and will continue the work to review applications. Thank you so much.
Thank you very much. And I'm going to invite Graham to come up here, but we are going to be over. And is there any objection to extending the time of the business meeting to accommodate the remaining items of business? Thank you. I'd like to now introduce Graham McDougall, who is chair of the nominating committee, who will present that report. Thank you so much for your leadership, Graham.
Thank you, Diana. The nominating committee was a big job this year. It was a privilege to chair the committee for the Academy this past year. The Academy is one organization that has a magnificent response to the call for nominations. This year we had a total of 84 nominations. 66 were self-nominations and 18 fellows were nominated by other fellows for leadership roles. A total of 45 individuals went on the ballot for elected positions. So this is a competitive process. The committee met by phone multiple times to consider the applications. The key consideration is the quality of the overall application and the responses to the questions. In addition, the board made it very clear that we were to emphasize diversity, using a board view including race, ethnicity, gender, geographic area, and academia versus service and clinical. As you might guess, this all makes for some very challenging decisions as we try to weigh and balance the ballot around the broad vision of diversity. And the committee took this charge very seriously. But that also means some very qualified applicants may not made it onto the ballot. If that happened to you, we encourage you to submit your name again. At this time, I want to thank the members of the committee who were immensely engaged, productive, and responsive to the work that was needed. It was a pleasure to work with them. Donna McCarthy Beckett, Kathleen Bauer, Barbara Medoff-Cooper, Linda Grau, and Margaret Zalon. Joanne Dish, past president, was our liaison to the board. Thank you, Joanne, for your support throughout this process. And Joycelyn Kunick staffed the committee. Thank you, Jocelyn.
I'm going to invite Angela McBride to come up to this front microphone, and while she's doing that, I just want to say that the Academy is really fortunate to have many fellows who are willing to serve in leadership positions, as Graham just noted, and is noted in your business meeting materials. Would the fellows who serve as chairs of our standing committees, task forces, and expert panels please stand, and will the rest of us thank them for their service? Thank you so much. So the next item on the agenda is the report from the chair of the National Advisory Committee for our newly launched Institute for Nursing Leadership, the incomparable Angela McBride. Angela, thank you.
Good morning. It gives me great pleasure to give you an update on the first year of the Institute for Nursing Leadership. I have worked with Stephanie Ferguson And you heard yesterday that she is getting, as a White House Fellow for their big anniversary, a special award. She is also getting inducted tonight into the National Academy of Medicine. We worked particularly with Diana and Cheryl and a wonderful committee. We established a national advisory committee. We're going to have staggered terms. We put together terms of office, clear responsibilities, and a committee structure. We planned and implemented, and it will also, those who attended will get an evaluation for that pre-conference that was on Thursday morning. More than 200 people attended, so we were very excited by that. Developed a board readiness self-assessment tool to help people figure out where they are in terms of thinking of board readiness. We created a list of top matches to identify important boards in need of nurse representation. We launched a pilot state initiative to recommend nurses for key gubernatorial appointments. Did that in Nebraska, California, and Ohio. And we see this as something that is going to be extensive. And in fact, I see this as one of the initiatives that this year we need to go after separate funding for. We encouraged fellows to go online and update their profiles for a better handle on who has either current board experience or past experience. We are in the process of creating what we're tentatively calling a wisdom circle of fellows who have successfully served on important policy boards who can serve as coaches to newly appointed fellows. Because it isn't just getting people on boards, it's helping people, coaching them with maybe, and this then makes us multi-generational, because we have individuals with very rich policy experience, and even if boards don't say their ages, you know that your expiration date has arrived. Because they keep emphasizing getting more people on boards under 50. Let's just say on the IU Health Board that I serve, I am the most chronologically gifted person. We are in the process of developing with the overall board an evaluation plan for monitoring the effectiveness of fellows on boards. We not only want to get fellows on boards, but we want at a future time to be able to tell you a list of achievements that getting nurses on board that it made a difference. We're identifying initiatives right now that we can do where we can then get separate funding. Nobody ever gives you money for, except fellows, but outside people don't give you money for basic supports. So identifying separate efforts that we can move forward. We've done benchmarking. At this point in time, there are 219 fellows on boards, commissions, or councils at the state or national level. I know that's an underestimate, because it's an underestimate because people have not filled out what they have done or are doing right now. By our calculations, we have 24 states represented. We have 18 unique boards at the federal level having fellows, 177 national boards, and 98 state. And again, I know it's an underestimate. So this takes me to what can each of you do as a fellow to move this initiative forward. The first thing that you can do is to update your online profiles so we can even get a better estimate for benchmarking those who are actively serving in positions. But we also want you, if you have served in those positions in the past, you will be a good candidate for that wisdom circle to then get engaged. We want you to contribute to the Institute for Nursing Leadership And I know it gets such a hassle. You know, I'm tired of listening. The only people who send me cards on my birthday these days are people who want me to remember them in their wills. So believe me, I understand the hassle about money. But the reality is they constantly want to know if the organization is supporting the effort, if they're going to give money. And everybody wants to leverage these days. And you are our leverage. So we need you to support for leverage. I want those who were involved on Thursday, you're going to get the evaluation with a bibliography on board work. And anyone who didn't attend, to give feedback on any ideas like that. Let's talk. What ideas? I've gotten lots of ideas, by the way, being here, but we want more. What I want to end with is to say that the notion that this organization is recognition on the way to engagement. I see the Institute for Nursing Leadership as between those two. You've been recognized, because we in the Academy see this as preparing fellows for the next step in their leadership journey. So in terms of, I look at Sue Hassmiller getting nurses on boards, our mission in the overall coalition is to help fellows with the next step on their journey. So a lot of what the Institute is going to do is going to be leadership development for people who are already leaders. And until the day you drop, you will still be learning. And our goal in this Institute is to help leaders get to the next level. I also want very quickly to thank Sheila Burke, Darlene Curley, Paula DeCola, Pat DeLeon, Joanne Dish, Stephanie Ferguson, Alicia DeGeorge, Catherine Gillis, Jan Heinrich, Randy Jones, Ramon Lavandero, Christopher Lee, Diana Mason, Susan Reinhardt, Corey Reeder, Cheryl Sullivan, Tony Villarreal, Rita Ray, and Colleen Conway Welch. Those are the people on our committee. You will notice we have fellows and honorary fellows, and we have golden oldies, but we also have people who just got into the Academy in the last couple years. Thank you.
Thank you, Angela. Extraordinary first year, would you say? And we're in good hands to continue. Thank you. So now I'd like to invite our fellow, Pam Cipriano, President of the American Nurses Association, was elected in June of 2014 as president of that association, to come forward and give the report from the American Nurses Association. Welcome, Pam.
Thank you, Diana. It's really been a busy year, and you will recall last year when I had the opportunity to address our membership that we were dealing with the threat of Ebola. Well, this year, nurses around the country and around the world dealt with the immediate threat of really serious foot-and-mouth disease by the hosts of The View. And I thank all of you for responding. But what it really emphasized for all of us is the enormous pride that every registered nurse has in this country and around the world. And really, I think it emphasizes the fact that when we speak with one strong voice, we make an amazing impact. And that's really what I'd like to share with you today, which is our strong voice together of the American Nurses Association and the American Academy of Nursing. And so I want to take just a real brief look back in examining sort of our history together and our history as we've both grown. So I think you may know that the AAN is about 120 years old. We'll be 120 next year. And the Academy is about 42 years old. But actually, the Academy was first proposed in the 1946 House of Delegates of the American Nurses Association. And I think particularly as we have newer fellows, we may not all be aware of some of this history. And initially, it was proposed to be a National Academy of Nurses to recognize personal achievement and superior performance in nursing. And that vision was really broadened to then look at individuals who were advancing the knowledge, education, and practice of nursing. There was actually a lot of debate as to whether research was part of that or not. There was also debate about whether the members had to be certified because there was no available certification for individuals in academic roles and research roles. So that morphed as the Academy was eventually founded. And it was believed that the American Academy of Nursing would truly be the vehicle to enhance the authority and effectiveness of the American Nurses Association. So then it was 1966 that official bylaws were put into place by AAN to establish the Academy, but it took us 7 more years, an investment of $50,000 by the AAN, and initial appointments by the board of the Charter Fellows, of which there were 36, and they were called the Working Company of Scholars. And I think you remember Reba DeTournier was the first pro tem appointee and then was elected the first president. And then over the ensuing years, the Academy would become self-sustaining. We're really in a new era that's about 15 years old. There were times where there were growing pains, but 15 years ago in 2000, when Ada Sue Hinshaw was president of the Academy, was when the Articles of Incorporation for the 501c3 entity that we know as AAN today was put into motion. I actually was on the governing council, so I've sat in these seats at that time. Mary Foley was the ANA president, and together they wrote about forging a new path together as both of our organizations were changing. But those Articles of Incorporation designated ANA as the sole corporate member of the American Academy of Nursing. So we are inextricably linked and always will be. And it's important because part of what was defined was the respect for the autonomy of the Academy, but also a linkage and a role of a very high level of oversight. I have truly enjoyed my time working with Diana Mason this year. I look forward to working with Bobby Berkowitz because together we have many common agendas and we're really doing some great complementary work. And I want to take a minute to talk a little bit of the accomplishments. I know you probably at least glance at your emails that you get from ANA, and you might read the American Nurse and American Nurse Today, you know, as you're running from thing to thing. So I'm not going to go through a lot of the things we've accomplished in detail, but I want to really emphasize that our work is joint work, and we are successful in large part because we have many Academy leaders who are also part of the work of ANA. And just to name a few, because I know I will not be able to hit everybody. Linda Aiken was one of the lead keynotes at our staffing conference last year. There isn't anyone in this room that doesn't know who Linda is. Her work continues to inform our current front and center agenda on staffing to make sure that we have safe care for patients, safe outcomes, and a really good work environment for nurses. B. Kalish was a lead speaker at not only our quality conference last year, but at the CNO luncheon at the most recent Magnet conference. Beth Ulrich was also a speaker at this past year's quality conference. And just to briefly mention Magnet, where we had many speakers, this was the most successful Magnet conference we have had. Almost 9,500 nurses came together. And they are the movers and shakers on our front lines, and it's really an honor to support them. As you know, 2015 was the year of ethics, and we have many fellows to thank for their work on the ethics committee and the panel that revised the code of ethics. But most notably, Marcia Fowler has done an enormous amount of work in helping create the publications to move the code forward and incorporate that into everyone's practice. At our ethics conference, Diana Mason, Gloria Ramsey, Cinda Rushton were key speakers in making the document come alive and really look at some of these key issues. In care coordination, we work together as two organizations that, again, know that this is a place where we have to put a line in the sand for the importance of the role of nurses, not just today, but articulating that to our public, to the payers, and really understanding how we can continue to advance that role for nursing. And Jerry Lamb and Robin Newhouse have been instrumental in that. At our membership assembly, Elaine Larson led discussion about emerging infectious diseases and how we can advance the issues of infection prevention. Lily Jelinas talked about quality measurement, and as you know, she is our current editor-in-chief of American Nurse Today. So we recognize that we have wonderful interface between leaders in the Academy who are leading efforts within the American Nurses Association. We have many of our past presidents of AAN who are members of the Academies. Most of them are here today. Barbara Nichols, Mary Foley, Becky Patton, Karen Daly. I don't know if Lucille Joel and Bev Malone are here, but again, part of those ranks. Our newly elected vice president for the AAN board, Ernie Grant, will come online in January, who is a fellow. Our current president of the American Nurses Credentialing Center, Michael Evans, and our president who will take office in January, Pat Reed-Ponte. President of the American Nurses Foundation, Joyce Fitzpatrick, and the incoming president, Tim Porter O'Grady, and board member Dana Alexander. Our Magnet Commission has been chaired for several years by fellows. Donna Havens is the current chair. Deb Zimmerman was the past chair. On the commission, we have Mary D. Hacker and Jeanette Ive Erickson. Our new executive consultant for the Minority Fellowship Program, a critical program for our focus on diversity and making sure that we have mental health professionals. Dr. Frida Outlaw, who replaces Faye Gary, all fellows. And I would be remiss if I didn't mention our primary cheerleader, Stephanie Ferguson, who it has really, again, emphasized the importance of our work together, and she's our international advisor in ANCC and for ANA. Many of the fellows have contributed to key work this year. Our statement on fatigue and how we can make sure that nurses in the workplace get the support they need and are not putting patients' care in the crosshairs by not having rest and not working too many hours. Our panel that created the work on violence, incivility, and bullying, part of the work that many of you do. Critical output in terms of really recognizing the issues that potentially threaten not only nurses physically, but certainly our work environments and the outcomes for patients and families. Our upcoming work on hospice and palliative care, the revised scope and standards of practice. Many of you have provided testimony. We supported the appointment of 46 individuals to federal positions this year, many of whom are fellows. So this mutual aid is really critical, and so I appeal to all of you to think about giving a hand up to your colleagues at home who are not necessarily Academy members, but that really happens at grassroots. That's where we're going to be successful. We need strong state nurses association because that's where local policy happens. They are the voice in our state houses. They are the voices in their communities. And so I really ask that all of you think about, is there an opportunity to give back a little time and a little nurturing and a little mentoring in your states? Connect with your state nurses associations. Make sure they know who you are, because this work is really critical. And I'll leave you with one last point, because I want you to know one of the things that I'm doing in my follow-up. I shared with you my priorities last year, and one of them was to make sure that nursing is top of mind when it deals with having a conversation or a national meeting. We want people to think about nurses as being the key voices and the experts that they come to. So one of the things that I'm sharing with all the groups that I meet with, and particularly when the group is not just nurses, but I'm asking them to look around the room, look left and look right. And if they're in a discussion where something is going to be affecting healthcare, either the delivery or the change or the implications of healthcare, they need to ask themselves, is there a nurse to their left or right? And if there's not a nurse or more than one nurse, then there is a critical voice that is missing from the conversation. So I ask you to do that as you go out as well. Ask your colleagues, look left and right. Make sure there is a nurse there to provide that voice. So I think we share this agenda with the Academy, and thank you for the great collaborative work. Thanks, Diana.
Thank you, Pam. It's been a pleasure to work with you, and thank you for your leadership. I'm going to ask you to wait until, as we move through some more business, and go ahead. Microphone.
Stephen, by the time I arrived here, the nominating committee report was done and we had moved on. So there's a comment I'd like to make, and
Please
probably a question, if that's okay now.
Yes, be quick, yes.
One of the observations that I've made is that I have not seen many international fellows on committees or even people returning to attend the meetings beyond the year that they got inducted. Now, I assume that we select the international fellows or any fellow both on the basis of their accomplishments as well as the potential of the fellow to be, to make a contribution to the mission of the Academy. Now, what kinds of opportunities are we giving to these people?
Thank you. And I appreciate the question, and I'd like to share with you very quickly what we've already done. We have invited, for example, on the Ebola Task Force, I believe we invited, and I'm not going to remember her name, and we don't call them international fellows anymore. We're their fellows. They live outside and work outside of the United States. We are looking to have them engaged. I know there are some here who have returned, but we also are looking to have a conversation with them about how can we more fully engage you given the distance. So, Shake, I think you're raising a very good issue that is on the minds of the board, and I think you will see some follow-up. And if you have ideas, I highly recommend that you talk to Bobby and share your ideas with her, and thank you for raising the issue.
Thank you.
Thank you. I'm moving us along because we're way over time here, but we want to use the annual business meeting to hear from some of our expert panels on the work they've done over the year. We started this last year, and as a result, we have invited 2 expert panels to provide very brief reports on their work. The first one is the expert panel on breastfeeding that's been co-chaired and superbly led by Diane Spatz. Diane, would you come up and provide your report on the panel's work? Is Diane here? Okay, I'm going to move on. The expert panel on quality is doing some very interesting data collection this year. It's co-chaired by Dory Sullivan and Kathleen White. Pat Stone is a member of that quality expert panel, will provide the fellowship with the report. Pat, thank you.
Thank you very much. We're very excited about the work that we've been doing. A year ago, we were very interested in quality measurement and the proliferation of quality measurement at our expert panel. And so we had a small work group that included Marion Bernholt, Nancy Dutton, Rhonda Hughes, and our co-chair, Kathy White. Our board liaison was Bobby Berkowitz, and we really need to thank Matthew Williams because he was superb in keeping and herding us cats. We're all doing this voluntarily. But what we've done is we looked at the issue. We met monthly via telephone conference, and then we decided we needed to do a little bit of research. It doesn't cost a lot of money, but we were doing some focus groups, and we did need some funds to have our focus groups audio taped and transcribed. We put together a protocol. We got IRB approval. We brought it to the board. They have supported us, so thank you very much. We're only a little bit behind. We hope to have we're doing our data analysis now. We hope to have a manuscript ready to submit to Nursing Outlook in the year. So thank you.
Great. Thank you so much. Thank you. So the next item of business is the report of the election results, and I'm inviting Academy Secretary David Keepnews to come up and provide that report. David?
Recently, you elected new officers and board members and committee members for the Academy, so it's my privilege to tell you whom you've elected. As President-elect, Karen Cox, Treasurer Paula Malone-Nuzzo, and I'll ask you just hold applause. Just a short list left. Board of Directors, Susan Albrecht, Linda Scott, and Patricia Hinton-Walker. Fellow Selection Committee, you've elected Janice Humphreys, Lynn Jean, Susan Apold, Donna Zazworski, and William Puentes. And for Nominating Committee, Beatrice Kalish, Nancy Redeker, and Joan Vitello. Congratulations and welcome.
I'm not going to restate that, as is in the script. Congratulations to the newly elected leaders, and thank you for sharing your talents and commitment with the Academy. Thank you. I asked you to join me in thanking our outgoing board members, Ruth Kleinpell, Eileen Sullivan-Marks, and Deborah Toney. They have dedicated significant time and energy to the Academy. Thank you. At this time, with the newly elected board, your new board, please stand. Bobby, get up there. your new board, continuing board members. During the next break, I'm going to ask board members to come to the front for a photo. So, I would now like to present to you your next president of the American Academy of Nursing, Dr. Bobby Berkowitz.
So all of you past presidents in this room know what a tremendous honor and privilege this is to be elected as your leader. You also know what an awesome responsibility it is. And in following Diana Mason, it's awesome on steroids. But I don't want you to lower your expectations. I am not alone. There are over 2,300 of you to help me. We have a fabulous board. I have a marvelous president-elect, and all of our expert panels and our wonderful staff led by Cheryl. I promise you I will do my best to communicate. I want to continue the work of member engagement, particularly through the expansion of the activities of the expert panels. I also want to work very hard on engagement of new fellows, both in the expert panels and as advisors to us. And I also promise you I'm going to be a good partner, both to you, to the board, and to all of the organizations we work with, and particularly to the AAN. So thank you very much for your trust. We're going to have a good time.
Good. Thank you. In the interest of time, I'm going to say that we've completed this agenda and the meeting is adjourned. If you have an issue, please put it in writing and bring it to us. Before you leave the room, Sally Lusk is doing a drawing, and then Terry Pipe is going to come up and do the healthy interlude, but it will be very brief. We are going to start. Yes? I'm giving you no personal privilege, Joanne. Be quick. The mic.
Can you hear me? Okay, I am Joanne Dish. I'm past president. I think there's something missing on this very tight agenda, and that's an appropriate thank you to you.
Thank you. Thank you. We don't count. Thank you. Thank you. Thank you. Thank you. I knew I shouldn't have recognized you. We don't have time. So we have this drawing for earmuffs, and I said, Sally, what is this for?
The Health Behavior Panel is offering a pair of earmuffs to protect your hearing when you're in noisy areas. Maybe at the soiree tonight, you'd like to wear them if you win. And
Jane Barnsteiner. And now, Terry Pipe, come up. Healthy interlude, and then you can have your break, and we'll start the back here 10 minutes later than expected.